hold on to your seats, because we're about to reveal some mind-blowing facts about Zyprexa, a drug that's both a life raft and an anchor in the world of psychosis. Prepare yourself. Honestly, I didn't get a lot of sleep last night. I woke up at 1 a.m. in a puddle of pee. And no, I know what some of you are thinking out there. It wasn't my own pee. It was my 5-year-old's. And let's just say that I might be a little off my rocker today, which makes it the perfect day to talk about Zyprexa, which goes by the brand name olanzapine. And just a forewarning, I'm going to go off on some relevant tangents, but I promise this is going to be a fairly comprehensive view of the medication. And before we get into all the details, I just want to make one thing clear. Zyprexa is not safe for anyone to use. It's prescribed to millions of people worldwide and has FDA approval, but that doesn't mean that it's necessarily a safe drug. What that means is that it might be safer than the alternative, which for some people may be severe and debilitating psychosis that either puts themselves or someone else in harm's way due to their severity of their symptoms. So yes, in that instance, although Zyprexa is always dangerous, it can be useful and ought to be used with a lot of discretion. And for anyone that wants to challenge me on this whole safety thing of the medication, like, I don't know, maybe there's some prescribers out there who hand out this medication like candy and think it's relatively safe, go ahead and take a starting dose of Zyprexa of 5 to 10 milligrams per day and come back to me in a month and we'll talk about safety. The reality is that anyone who might say this medication is relatively safe probably doesn't have a whole lot of personal experience taking the medication themselves. Have I seen dangerous psychotic symptoms relieved from this medication? Absolutely. So it certainly has a place in medicine. I just want to make sure everyone knows that despite its utility, it is always dangerous and thus ought to be avoided whenever possible. I also want to point out that the manufacturer in their package insert never states the medication is safe. If I use Control-Find to search the package insert of the medication, you'll notice there are 29 words that contain the letters S-A-F-E, but the manufacturer never states the medication is safe. Rather, they know as humans, we like the word safe and have a number of positive associations with it. And so in their package insert, they like to say things like, the safety and effectiveness of doses above 20 milligrams a day have not been evaluated in clinical trials, or the safety and efficacy of olanzapine has not been established in patients under the age of 13 years. When the manufacturer states the safety and effectiveness of doses above 20 milligrams a day have not been evaluated in clinical trials, this does not mean Zyprexa is safe in doses under 20 milligrams a day for adults. It just means the safety of the drug has been evaluated in doses under 20 milligrams. You see the little play on words there, just like we could evaluate the safety of someone, I don't know, chugging a gallon of gasoline and then later state in our package insert for gasoline that the safety and effectiveness of doses of gasoline beyond 1 gallon has not been evaluated in clinical trials. What I'm trying to point out here is that the manufacturer has clearly and cleverly smuggled the word safety into their package insert 29 times to euphemistically give readers and doctors the impression the drug is safe, when in actuality, it's not. Okay, to be fair, I'm speculating here about the manufacturer's intent. I haven't spoken to anyone at Eli Lilly, and even if I had and it's were all true, they certainly wouldn't confess it to a schmuck like me. Nevertheless, this medication is far from safe. By the way, did you know Zyprexa isn't vegan friendly because it contains the inactive ingredient lactose, which is the sugar present in mammal milk? I can just see myself as a patient somewhere waving my celery sticks at the psychiatrist while telling him, I know Zyprexa is an involuntary medication, but it contains lactose, and I'm a vegan. I don't do cows. Do you have any tofu-based alternative? All jokes aside, believe it or not, one of the listed contraindications for Zyprexa is actually being lactose intolerant. Zyprexa is an atypical antipsychotic. It was released to the US market in the fall of 1996, and for anyone out there who wants to kind of nerd out on how the drug works, it binds primarily to serotonin receptors and somewhat to dopamine receptors as well, but honestly, no one really knows what's going on inside of our brains after we take Zyprexa, which is why the manufacturer states in their package insert, the mechanism of action of olanzapine in the listed indications is unclear. If you want to ultra nerd out on Zyprexa, I've included some interesting references in the detail section of this video. You can take Zyprexa with or without food. It doesn't really matter. Often I see patients take 5 to 10 milligrams daily, and if the patient has been taking Zyprexa for some time, it's fairly common to see them take a small dose in the morning to control symptoms throughout the day while minimizing sedation. And then at bedtime, they might take an additional 10 to 15 milligrams. Generally, you wouldn't want to take a large dose in the morning, like anything above 5 milligrams, because it often robs people of their energy and motivation throughout the day. And none of us want to feel like vegetative zombies while our symptoms of schizophrenia are being treated. The maximum daily dose for an adult is 20 milligrams, but I ain't gonna lie, oftentimes you'll see patients on much larger doses beyond 20 milligrams. The most I've seen a patient take was 40 milligrams daily, and I think he had an as-needed dose of Zyprexa somewhere between 5 to 10 milligrams. He was a larger gentleman, maybe weighing around 220 pounds, but nevertheless, 40 to 50 milligrams daily of Zyprexa is a whammy dose. That's a whammy dose of this medication. And if you were to take this dose and had never taken Zyprexa before, you'd probably be sleeping for 24 hours straight, maybe even longer, because the med is that powerful. If you happen to miss a dose of Zyprexa, the manufacturer recommends taking your dose as soon as possible unless most of the day has passed. Then you can wait until your next scheduled dose to take it, but definitely don't take 2 doses at once because you don't want more of this medication than absolutely necessary to control your symptoms. Usually I see Zyprexa used in patients diagnosed with schizophrenia or schizoaffective disorder or bipolar 1 disorder, but it's also approved for treatment-resistant depression in combination with fluoxetine, also known as Prozac. So why does the maker of the medication only state it's approved with Prozac and not other SSRIs or antidepressants when there are so many of them on the market? What makes Prozac so special? Certainly for skeptics such as myself, it's not a mystical molecular mingling occurring between Prozac and Zyprexa, whereby this wondrously woven pharmaceutical fusion forges the finest formula to fight depression. Thumbs up if you like alliteration. In my unqualified and uninformed opinion, I do believe it's a case of chemical nepotism. Both Prozac and Zyprexa have the same parents. They're manufactured by the same company, Eli Lilly. They need to make as much money as possible, so of course, it's their own antidepressant in combination with their own antipsychotic that purportedly treats depression. And of course, I promise I'm not going off on a cynical blame big pharma rant here and how if Eli Lilly really cared about people, it would test Zyprexa along with other SSRIs to see how much they helped, or how despite so much high quality evidence showing antidepressants are no better than placebo, how it was suspect for them to study Zyprexa in combination with Prozac for treatment-resistant depression in the first place. I promise that's not where I'm going, and I believe in the benevolence of Eli Lilly. I really do. Let's get back to talking about Zyprexa. Zyprexa is a very powerful antipsychotic. In fact, I'd probably put it just beneath Clozaril in terms of its potency. It puts people to sleep, it sedates them, and psychiatrists love using this drug when a patient is experiencing psychosis and is really agitated because it tends to decrease the expression of their symptoms while also sedating and or putting them to sleep. And oftentimes patients just need some sleep in order to recover. This is my favorite medication for when a patient is extremely agitated and nothing seems to calm them down and they're a danger to themselves or perhaps to someone else. And I will say, despite Zyprexa's horrible side effects, in my experience, it has a proven track record for calming down acute psychosis and mania. And I really want to point out here, I am saying a few times in my experience when it almost seems like a miracle drug when it comes to curing a patient's schizophrenia. I've talked about a few patients I've seen in other videos of mine where after a few days or weeks of taking Zyprexa, their delusions and disorganized speech were vastly improved. At the same time, I don't want to give Zyprexa more credit than is due because often I think it's overprescribed and has caused innumerable harm to a lot of people because of its dangerous side effects. Just like a gun though, Zyprexa is a tool that can easily be misused. So perhaps my beef isn't so much with Zyprexa in and of itself. After all, how can one fault a chemical? But more so with people who prescribe this medication without really doing a cost-benefit analysis. Nevertheless, if a patient is acutely psychotic and agitated and very dangerous, I'm confident Zyprexa can help in this situation. Here's a random fact about Zyprexa. Did you know it can cure hiccups? Apparently there was this 59-year-old man who had the hiccups for more than a year. Can you imagine having the hiccups for more than a year? Like that would be so annoying. He had a medical history longer than a CVS receipt and for whatever reason couldn't get rid of his hiccups. So finally the doctors tried using baclofen, a medication used for muscle spasms, along with a low dose of Zyprexa, and guess what? his hiccups went away. So what's the minimum age someone could take Zyprexa according to the researchers at Eli Lilly? Could a 4-year-old take this medication? Well, not exactly. According to the package insert, they don't know if Zyprexa is safe or effective for kids younger than 13. So patients have to be at least 13 years old before taking this medication. Yet I've heard of stories of kids as young as 3 or 4 taking this medication. And yet I can't really imagine a situation when a kid that young would actually take Zyprexa. It just doesn't make sense. I once talked with a prescriber who said that she had prescribed Zyprexa to someone who I believe was 4 or 5 years old. And that's because he stabbed his mother with a knife in the stomach. Unfortunately, I don't really know much information beyond that. So perhaps someone who has experience in pediatrics can leave a comment as to why a child might take Zyprexa or what circumstance and detail would warrant using a medication like this on a child. The manufacturer even states medication therapy for pediatric patients with schizophrenia or bipolar 1 disorder should be undertaken only after a thorough diagnostic evaluation and with careful consideration of the potential risks. In case you miss the subtext here, the manufacturer is acknowledging just how dangerous their drug is in regards to kiddos. They're basically saying like, hey, you really need to make sure the benefits, the potential benefits outweigh the realistic harm this medication causes, because Zyprexa's no joke. Zyprexa is available orally in swallowable tablets and in tablets that dissolve in the mouth. The oral tablets can be crushed, and when I worked at the state hospital, many patients would be on what are known as crush and float meds. So for instance, with Zyprexa, we'd use a machine to crush the med into a fine powder, and then we'd mix it with applesauce, and that's how we would administer the medication to ensure compliance among patients who either like to cheek Zyprexa or to just spit it out in the trash. Zyprexa is also available in both a short and long-acting injection. So sometimes if we had a patient who was court-ordered to take an involuntary medication and they were refusing their antipsychotic medication orally, then often we would administer 10 milligrams of Zyprexa, which would be injected into their muscle, either in their deltoid or on the lateral aspect of their buttocks. And within about 5 to 10 minutes, you would usually see the medication start to take effect. Just a quick side note about my experience with Zyprexa injections. When I worked at the state hospital, if a patient was refusing an involuntary medication of Zyprexa 10 milligrams orally, then they would be given 10 milligrams of Zyprexa against their will in the form of an injection. Why am I mentioning this? Because we know when a medication is taken by mouth, the liver breaks the medication down, and the amount of drug that then goes directly into the bloodstream is usually anywhere from around 40 to 60% for most medications, meaning that if I give a patient 10 milligrams of Zyprexa orally, she's only going to get around 4 to 6 milligrams that her body's actually going to use. Whereas if I give somebody an injection into their muscle, they get about 100% of that medication because it bypasses the liver and goes directly into the bloodstream. So someone please help me understand why on earth a patient who is prescribed 10 milligrams orally of Zyprexa and refuses would then get an involuntary injection of 10 milligrams intramuscularly. Because essentially we'd be giving them 4 to 6 milligrams more of the medication than they normally take. Help me understand. Oh, no. Don't worry. Don't help me understand. I actually mentioned this concern of mine to the head psychiatrist who worked at one of these institutions, and she told me that the reason a patient receives 10 milligrams intramuscularly instead of, say, 5 milligrams intramuscularly, which would make more sense, right, if they were taking 10 milligrams orally, was because Zyprexa was supplied by the manufacturer in 10 milligram vials. To which, of course, I quirkily responded, so if the medication was supplied in 100 milligram vials, how much would you give the patient? Well, it's good to know that our prescribing practices are sometimes governed by the quantity of a vial rather than what a patient may actually need. By the way, I checked the monograph for Zyprexa, and here are the supplied vial sizes for your reference. After looking at that table, it looks like if I had a vial of 10 milligrams of Zyprexa, and I added 2.1 milliliters of sterile water, and then I were to draw up 1 milliliter of the mixed solution, I'd have a total of 5 milligrams of Zyprexa to administer to a patient, despite the vial containing an initial 10 milligrams of Zyprexa. Maybe I'm wrong here. I'm sure I misread something. Another quick side note, love to all my nurses out there. I can guarantee you as a nurse, if I gave the same patient 4 to 6 milligrams orally of their medication beyond, say, the 10 milligrams that they were supposed to get, it would be a med error and the hospital would be all up in my ass, but I digress. Zyprexa is available in 2.5, 5, 10, 15, and 20 milligram tablets, and if you want the dissolvable form, the same milligrams are available, except they don't make the orally disintegrating tablets, ODTs, in 2.5 milligrams. I have no idea why. Here's a random fact about Zyprexa. If a rat takes 174 milligrams per kilogram per day for who knows how many days because the manufacturer didn't specify, the rat has a 50% chance of dying. 174 milligrams per kilogram per day is about 45 milligrams of Zyprexa for a rat weighing around 250 grams. 45 milligrams of Zyprexa is a whopping dose for humans and an absurdly humongous dose for rats. So this would be the equivalent of a human taking around 3,200 milligrams per day, if my math is correct, which it probably isn't. By the way, I'm fairly fond of rats and they're really cute, so let's keep them alive. What happens if you overdose on Zyprexa? There's a good chance you'll develop a fast heart rate, become agitated or aggressive. You may have problems speaking or forming words. You might even have some involuntary movements here and there, and you might get super sleepy or potentially go into a coma. Some people have died after taking 450 milligrams of Zyprexa, and others have survived after taking 2,000 milligrams of Zyprexa. And how anyone could survive 2,000 milligrams of Zyprexa is beyond the small scope of my knowledge. I would think that that dose would kill next to 100% of people, but what do I know? The way Zyprexa overdose is managed is by usually pumping the stomach and using activated charcoal. When charcoal's used, it decreases the amount of Zyprexa available to the body anywhere to around 50%. So if someone were to overdose on 100 milligrams of Zyprexa and then were to be administered some good old activated charcoal, that would mean that they'd be exposed to around 50 milligrams of Zyprexa. After those interventions, then it's pretty much just supportive treatment from there on out. Things like IV fluid, managing respirations, and monitoring blood pressure, as sometimes patients who overdose on Zyprexa can develop life-threatening low blood pressure. Zyprexa reaches the highest level in the blood after about 5 to 8 hours of administration, and so it may take a little bit of time before feeling its full effects. And it often takes around 30 hours or so before half of the drug is eliminated from our bodies. Random fact about Zyprexa. Did you know every time we take this medication, we're ingesting a little bit of carnauba wax? Carnauba wax comes from a Brazilian palm tree. Who needs a passport when you got a prescription? I wonder if this explains all the palm trees inside of my shrink's office. When Eli Lilly conducted their clinical trials for efficacy, that is to test to see how well the medication worked on reducing symptoms of adults diagnosed with schizophrenia, I want to point out that in their 2-week trials, they only lasted 6 weeks. From my experience working with over hundreds of patients taking this medication, no one stays on Zyprexa for only 6 weeks. They're typically on it for months or years down the road. And I'm mentioning this because even if we assume the medication is as effective as the manufacturer states it was in 6 weeks, which is kind of a strong assumption given the clear financial conflict of interest and the history Eli Lilly has of telling the truth, 6-week efficacy is not a guarantee of long-term efficacy. So the manufacturer cannot state that beyond 6 weeks, their medication is beneficial because they haven't tested it. Nor does it appear they blinded the researchers when they did their 2 trials, meaning that the researchers knew which participants were taking Zyprexa and which were taking the placebo. And as we all know, when Big Daddy's paying you a handsome sum to test his medication, well, you better make Big Daddy happy. Okay, that was kind of awkward. Look, normally when you conduct good science, you want researchers to be blinded, meaning that they don't know which participants are receiving the placebo, an inactive substance, and which participants are receiving the medication, the active substance, and in this case, Zyprexa, because we want to be able to rule out any bias the researchers may have when they are assessing the medication's effect on patient outcomes. And look, the reality is researchers are human beings, and if they are being paid large sums of money to test the efficacy of a drug, and this money is being paid to them by the same people who manufacture the drug, well, you get the picture. Another thing I want to point out is that I cannot find the word randomized in either of the 2 6-week clinical trials. Normally, and again in good research, you want to randomize who receives the active treatment, Zyprexa, and who receives the placebo, this prevents researchers from cherry-picking or selectively choosing participants who they believe might have a better chance at responding to the medication or who have symptoms that may have a better chance at decreasing while taking the medication. But don't worry, I'm sure Eli Lilly would be above this kind of research fraud, and I'm sure we can trust what they do behind closed doors. We're going to pause for a little ASMR. I also want to point out Eli Lilly did a maintenance trial of 326 adults. What they did is they took 326 participants who had been taking Zyprexa for 8 weeks and who were stable on the medication. And then, for whatever reason, they found it convenient to use randomization here. They randomized these adults to either placebo or to continue the dose of Zyprexa they had been taking. And guess what they found out? The people who were switched to placebo after the 8 weeks had many more psychotic relapses. Wait, you mean to tell me if we abruptly discontinue a psychotropic medication after the brain has accommodated to the decrease in dopamine and serotonin this drug causes? You mean to tell me that randomizing people to a placebo caused a rebound in their psychosis? No way! Allow me to share a bit of an analogy for you. Imagine this. We're studying the effectiveness of life vests. We have 100 people blissfully floating in a warm and serene lake for 8 weeks. Life is amazing. They're enjoying themselves. Meals are delivered. Bathroom breaks are a breeze without the need for a toilet, and showers? Pah! Who needs them? Everything's fantastic. But then suddenly, we decide to yank the life vests off 50 participants, and splash, they all drown. Can we really say from this example that the life vest was effective? Not exactly. What we can say is that abruptly taking away something people depended on can lead to disastrous consequences. Just like stopping an antipsychotic medication cold turkey can trigger rebound psychosis. Come on, Eli Lilly, you know better. And to extend this life vest analogy a little further, just maybe while wearing the life vest, these folks didn't use their legs to tread water as much as they should have, and so their muscles atrophied. Their life vest turned into a crutch, their muscles got weaker, and once the vest was removed, their legs simply didn't have the strength to keep them afloat. This definitely makes me wonder about the various neurotransmitters we have in our brains and how they respond and adapt when a medication is abruptly removed from their environment. And hey, maybe it's just me, but doesn't it seem a tad bit unethical to toy with people's lives like that? Like, hey, you're stabilized, and now let's just rip off the Band-Aid without any sort of proper titration whatsoever. And then we're going to use that to measure the benefit of our maintenance treatment for our antipsychotic. Anyhow, I feel like I've been dogging quite a bit on Eli Lilly and Zyprexa, so let's talk about the potential benefits of this medication after I share with you a random fact about Zyprexa. Did you know that when they were testing Zyprexa on female rats, that Zyprexa was found in higher concentration in female rat breast milk than it was in their blood stream? As to the benefits of Zyprexa, as a nurse, I've seen this medication definitely help dampen the outward expression of psychotic symptoms patients display. In other words, oftentimes you might see a patient diagnosed with schizophrenia talking out loud to themselves frequently as if they're having a conversation with someone else. Usually after taking Zyprexa, what I'll notice is they still do this. It's just not as pronounced. Now they might whisper and speak less. A lot of patients state that Zyprexa doesn't make the symptoms go away. It just makes them care less about them. Other patients will tell you that it does help decrease the severity of their symptoms, but that they are still there. I remember we had one patient who was acutely delusional, thinking that he owned the entire psych hospital and that all the staff working there were his employees and that he was disappointed in their performance and laziness. Now, although it is true that people who generally work in psych are lazy, myself included, he was certainly confused about owning the state hospital, and I never once received any sort of compensation from him while I was working there. Nevertheless, after about 2 days or so of taking Zyprexa and getting a lot of sleep, his delusions completely disappeared. And he was able to speak with me calmly and even eventually laugh about his delusions with me. That's actually pretty damn cool when you think about it. And it's kind of miraculous. So as much shit as I may talk about Zyprexa, there are a number of cases where I can say with a fairly high degree of certainty that it's absolutely helped some patients overcome their psychosis and breathe a certain amount of clarity into their life. That said, let's talk about the side effects of this medication. But wait, here's a random fact about Zyprexa. Did you know it causes catalepsy in rats in high doses? Catalepsy is a medical condition that can make a person's body become very stiff and rigid. They may also lose awareness of their surroundings and their ability to feel. If someone has catalepsy, they may be in a trance or a seizure and they might not even realize it. This is probably why, at least this is my hunch, when they tested Thorazine, another antipsychotic similar to Zyprexa back in rats in the 1950s, the rats didn't move from the electrified cage, probably because they were cataleptic. Zyprexa is known for having a number of side effects, including weight gain, low blood pressure upon standing, seizures, loss of balance, cognitive and motor impairment, constipation, sedation, dry mouth, headache. Look, the reality is Zyprexa has a ton of side effects. And what I usually saw as a nurse, especially when someone was starting this medication, was constipation, headache, weight gain, along with a lot of other metabolic side effects like an increase in cholesterol and triglycerides in their blood work, fatigue, a cognitive slowing, and a blunting of emotions. I would say those were the most common side effects you would see. And most people on Zyprexa will experience at least a few of them. The weight gain can be quite dramatic, maybe a third or a pound per day for a number of weeks. I came across a study I'm forgetting at the moment, but it said the average person gains around 5 to 6 pounds the first month they start Zyprexa. This seems probably true to me, but a little bit of an understatement. I'd say in my experience, 8 to 10 pounds seems a little more reasonable. But what I will say is this: if you are already obese and have a decent amount of truncal obesity, that is weight that's around your stomach and around your belly, and you live a sedentary lifestyle and you eat junk food more or less, and then you like to swish it down with some Coca-Cola, and especially if you're female, because females generally have slower metabolisms than males, I'm going to bet there's a pretty darn good chance you're going to be gaining 1 pound per day for about 2 to 3 months. Oftentimes, the weight gain as a result of Zyprexa can have a profound effect on how a person views herself. Imagine you weigh 150 pounds and then 2 months later you weigh 170 pounds and it's all fat. Imagine how you might feel about yourself, or how you might feel as you look in the mirror. Of course, this rapid weight gain, at least in my unqualified and unscientific opinion, seems to make some sense because Zyprexa makes us tired, probably messes with our metabolism, and then also makes us hungry. So people tend to sleep more, eat more, and exercise less while taking this medication, which we all know is a perfect combination for excessive weight gain. Here's another random fact about Zyprexa. Did you know stopping this medication abruptly, which you should pretty much never do, may cause sleep disturbances? Here's a woman's account I found on YouTube of her sleep disturbance after stopping Zyprexa.
I had started to get weird dreams, so my sleep was disrupted after tapering to 1.5 milligrams. And yeah, the sleep disturbances continued for quite a long time. I had sleep disturbances for a good year and a half, maybe even close to 2 years off of olanzapine, but definitely the worst was a year and a half.
Continuing on the side effects of this medication, Zyprexa causes diabetes. In fact, Eli Lilly had to pay over $1.4 billion. That's the equivalent to if you had $1 million 1,400 times for, shall we say, promoting Zyprexa for off-label use while downplaying its side effects like diabetes to its consumers. I'm sure this was just all a misunderstanding and wasn't intentional whatsoever on Eli Lilly's part. I'm also sure there weren't any internal documents expressing concerns about the corporation's finances or reputation in relation to the drug's side effects and how Eli Lilly would keep these side effects a secret. I'm sure that didn't happen. Or how they targeted naive physicians and exaggerated the benefits of Zyprexa while minimizing or omitting the risks. No. Misconduct like that would never occur at such a prestigious and ethical corporation. But let's continue talking about side effects. You know, one thing you often hear with antipsychotic meds is that the typical antipsychotics or the older generation ones like Haldol, perfenazine, thorazine, for instance, cause a lot more extrapyramidal side effects. Things like tardive dyskinesia or akathisia. These are all movement disorders stemming from the debilitating effects of antipsychotic medications. Maybe this is true. Maybe the older antipsychotics are more likely to cause involuntary movements in people. There seems to be a lot of research supporting it, and a number of patients have told me anecdotally they've experienced it. What I will say, though, is that especially if you're taking Zyprexa long-term, months to years, for instance, there's a good chance you will develop a tic or a tremor or some kind of involuntary facial movement. So although the risk may be less than some of the older antipsychotics, I've absolutely seen many patients develop involuntary movements as a result of taking Zyprexa, and this side effect definitely needs to be taken into consideration before starting this medication. Here's another random fact about Zyprexa. When you smoke cigarettes, your body breaks down Zyprexa about 40% faster than someone who doesn't. Zyprexa also has a black box warning on their medication that states if you're old, you have dementia, and you have psychosis, and you take Zyprexa, you're more likely to die. So if a patient meets these criteria, they should not be taking Zyprexa. Well, I think that about wraps it up for Zyprexa. Again, there are very limited circumstances when this medication should be used, and it can have a profound and beneficial effect on someone's psychosis. At the same time, it's best to avoid this medication when possible. The side effects are just simply too dangerous and burdensome. Thanks for watching, and remember, always trust in Big Pharma.
For a whirlwind of miraculous recoveries, alarming side effects, and a pharmaceutical company that's more dubious than an umbrella and a hurricane. From astonishing weight gain that'll have you questioning your scale sanity to involuntary movements that would make Michael Jackson envious, it's no wonder that Zyprexa is a recipe for controversy. So grab your favorite beverage, but perhaps skip the donut, and join me as we take a wild and unpredictable ride through the mind-boggling, hotly debated, and sometimes downright outrageous world of Zyprexa.